Hi, my name is Jordan. I'm Dr. Tal's nurse, and today we're going to be going over your pre-op instructions. We are going to go over instructions for your upcoming labiaplasty procedure under general anesthesia. First, we'll go over your medications. We're going to call in a few medications to a pharmacy near our office when you come in person for your pre-op. The first medication is an antibiotic. It's Keflex. This is the only medication out of all of them that you have to take. It's just to prevent any infection after the surgery. You're going to start it at about 10 p.m. the night that you get surgery, and it's every 8 hours around the clock until it's gone for 5 days. If you have an allergy to penicillin, this will be a doxycycline antibiotic instead, and it will be every 12 hours. Again, the antibiotic is really the only one you have to take. The others are just as needed. The next medication is a pain medication. It's called Vicodin. It's very strong. You only take it if you have a lot of pain and really need it after the surgery. It doesn't really have great side effects. It can make you nauseous, dizzy, constipated. So if you don't have a lot of pain, try to stick to extra strength or regular Tylenol. But just remember, Tylenol is the only other thing you can take. You can't take any Advil, Aleve, Motrin, aspirin, anything like that. So it's either Tylenol or the Vicodin, and you can't take the Vicodin and the Tylenol together. It is one or the other. The next medication is just a law in the state of Florida that anytime I prescribe the Vicodin, I have to prescribe something called Narcan. It's a nasal spray. It's only used if, God forbid, you take too much Vicodin and you overdose and you're unresponsive. I've never had a patient need this. It's just a law in the state that I have to prescribe it with the Vicodin. And the last medication is an anti-nausea. It's called Zofran. It's just 2 pills. It's there if you're nauseous from the anesthesia. If you are going to be nauseous, it tends to only be for the first 12 to 24 hours. So if you're nauseous, take it. If not, same as the pain medication, just get rid of it. Now, aside from those medications, the only other things that you can take are vitamin C, 1,000 milligrams a day, Tylenol if you need it for any reason before or after the surgery, and arnica for any bruising and swelling. Other than those medications, unless we told you otherwise, just need to check with our office to make sure. You also want to avoid any herbal teas or herbal supplements, and then 1 week before, no caffeine and no alcohol. If you drink a lot of caffeine, you want to try to kind of taper down off of it, so by the time you get to 1 week, you're having nothing. You also want to avoid anything that can cause an infection, tattoos, piercings, laser, dentist, manicure, anything like that you should avoid, and we'll tell you when you can resume everything again after the surgery. The night before surgery, no food or water past 10 p.m. You brush your teeth in the morning, but that's it. The night before and the morning of, you're gonna wash really well and don't apply any lotions, perfumes, deodorants, anything like that. If you wear glasses, not contacts. If you have your period, wear a pad, not a tampon. And then you'll need to wear something very comfortable. I recommend for labiaplasty, you wear a dress or a skirt, something that's not tight or going to rub the surgical area. That area is very delicate after the surgery, so you don't want anything that will irritate it. Somebody needs to pick you up and take care of you. You can't be alone for at least 48 hours. It's recommended for closer to a week, but at the very least 48 hours, somebody needs to be with you, and somebody needs to come with you to your first follow-up appointment. By your second follow-up appointment, you can usually come alone. For the first week, you'll sleep in a reclined position with a couple of pillows behind your back, a couch, recliner, whatever's most comfortable for you. And then I always recommend putting a pillow underneath your knees so your knees are bent and you can't move side to side or roll over while you're sleeping. For the first week, you also cannot take a regular shower. So you'll do sitz baths. These start the day after your surgery. You'll receive a link to Dr. Tal's Amazon with a bunch of pre and post-op recommendations. You'll need to refer to the section titled Labiaplasty for all of those recommendations. There's sitz baths available on there, as well as the Epsom salts that needs to be unscented. We have that on the Amazon, or you can get it at a Walgreens or a Publix or something like that. They'll start, like I said, the day after the surgery. You're going to hover over either the sitz bath or the water mixed with the Epsom salt in a bowl or a bucket, and you just splash up into the surgery area. You'll do this twice a day, starting the day after surgery. You want to make sure you're cleaning the area very well, but you also need to make sure you're being gentle enough so you don't cause any issues or tearing after the surgery. And then 1 week from the surgery, you can take a regular shower. Some patients like to continue doing the sitz bath even when they do shower, because when you do shower, you can't scrub or anything like you usually do, so the sitz bath will just help keep it clean. There's something else on the Amazon under the labiaplasty section that you'll need to order before the surgery, and it's the disposable underwear. Order that and you'll start changing the underwear the day after the surgery, after you start doing the sitz bath. You can change it as often as you want, and if you get the disposable underwear, you'll be able to just throw them away after each use. You'll also need to order the incentive spirometer from the Amazon, which is something that will help expand your lungs after being under general anesthesia. You start using it when you get home from surgery that day, use it for about a week to 10 days, and then you just get rid of it. After surgery, it's very important. You'll need to be walking with your legs spread apart, so it's not having any friction or anything in the surgery area. You should continue to wear a dress or a skirt, no tight pants or shorts. And again, you'll kind of walk like a penguin with your legs spread apart for the first week to 2 weeks, and we'll guide you in your follow-ups of when you can start to move around normally. You want to make sure you're not crossing your legs and you're moving your feet around as if they're on a gas pedal, just to help circulate the blood. You don't want to go out for a walk or really go anywhere, because that area, like I said, is extremely delicate, and you don't want anything that will cause like a tear that will need you to go back into surgery to fix. Nothing can go inside for 6 weeks, no sex, no tampons, until at least 6 weeks from the surgery. Dr. Tal will examine you at that time and clear you for everything that we had you stop beforehand. If you have any questions, just call our office or email me. I have my email here, and we look forward to having you for your in-person pre-op and for your upcoming surgery.